As things return to normal after COVID-19, those Medicaid expansions that helped many get through the pandemic are going away. The latest numbers from the health department in Arkansas show that more than 68,000 Arkansans lost coverage in May. 20,000 of those are kids. Jalissa Garza joins us now to break down those numbers and looks at how groups are working to help these families figure out what's next.
For the biggest group of kids that are losing Medicaid are those that are in the lowest income families.
20,000 kids in Arkansas living without health care coverage. That number alarming to Arkansas advocates for children and families.
There's a lot of things that need to happen to make sure that these kids stop losing coverage.
Health Policy Director Loretta Alexander says they're working to bridge the gap between families and the Department of Human Services.
A request or a concern or a complaint, we have an open communication with DHS, so we immediately forward that information to DHS to ask them to help that family.
According to DHS, during the COVID-19 public health emergency, people on Medicaid couldn't lose their coverage, even if their circumstance changed. But that's no longer the case.
A lot has changed in the last 3 years. Unemployment is lower than it was before the pandemic. We've had a couple of increases in the minimum wage. So circumstances may be different for somebody who was eligible before and are not eligible now.
For the thousands of people across the state facing a future without Medicaid, there are still ways to see if you can get it back.
You have, depending on your category of assistance, either 30 days or 90 days after your case has been closed that you can actually provide the information that we didn't get before.
Gavin Lesnick with DHS says if they get the information needed and see you're still eligible, they'll reopen your case.
We want to limit the number of cases that are closed because a person was unaware. And that's why we're doing so much outreach.
Jalissa Garza, 5 News.